Are you ready to dive into the world of aesthetics but feeling overwhelmed? Do you feel like it's so oversaturated that there's no point even bothering? Don't worry, guys, I've been there and I've made all of the mistakes possible, and I'm still learning as we speak. So, whether you're a complete newbie or you're just looking to level up your skills, these are my tips that will help you avoid common mistakes and set yourself up for success. Hey guys, if you're new here, my name is Komal and I'm a dentist based in the UK with a facial aesthetics business. In this video, I'm going to reveal 4 essential tips that will kickstart your facial aesthetics business in the right way. So let's start with number 1. Facial aesthetics is an unregulated industry in the UK. This means that anybody can perform facial aesthetics treatments with literally minimal to no training. If you're not medically trained, such as you don't have a GDC, DMC, NMC, or a prescriber's qualification, it's important to consider the treatments you provide in facial aesthetics don't involve medical substances and don't involve invasive techniques that require meticulous cross-infection. There are many options for non-medics to perform facial aesthetics, which are non-invasive. For example, skin treatments, that could be facials, peels, microneedling, body treatments, that could be lasers or body sculpting techniques such as fat freezing, and cosmetic procedures such as eyebrow tinting, eyelash extensions, cosmetic makeup applications. All of these examples, and I'm sure there's many more out, they don't require medical training or a medical background, just good skills and probably a beauty qualification. I think level 3 or 4. Injectables, especially botulinum toxin, is a prescription-only medication. Therefore, it really shouldn't be in the hands of somebody who doesn't have a medical qualification. And then injectables like dermal filler and skin boosters, they aren't prescription medications in the UK, but they do require a deep understanding of facial anatomy, potential allergic reactions, and how to handle medical emergencies. I think these treatments should be reserved for trained medical professionals who have the knowledge on how to handle any complications that might arise. I think it's really important to respect these boundaries, both for patient safety and so that we can maintain ethical standards in our industry. So I'm speaking from experience as a medical professional. If you are interested in aesthetics but lack medical qualifications, focus on treatments that don't require invasive techniques or the use of medical substances, or trained to be a medical professional. We can all offer valuable services and facial aesthetics treatments while respecting professional boundaries and the health of our patients or clients or whatever you call them. So if you are a medical professional, this video is more directed to you. So let's dive into number 2, which is courses and training in aesthetics. First thing you need to know is you need to choose the right foundation course. Based on my personal experiences, most courses often fall short in providing the deep knowledge needed for safe and effective practice. One-day courses might be appealing because we know we're already a doctor, we're already a dentist, we're already a nurse. We inject people daily. We know the anatomy. We know how to handle medical emergencies. What's the worst that could happen? But guys, after having gone on these courses, I can 100% guarantee they will give you the basic knowledge and a superficial overview of techniques, but you will leave thinking, what the hell just happened? Short courses, they often lack comprehensive knowledge needed to perform procedures effectively and safely. When we were at uni, we had to do 1,000 crown preps, 1,000 endos, and see 1,000,000 patients before we were let loose out into the world. So how is it that you can go on a one-day course, inject a quarter of someone's lip and a bit of someone's forehead, and you're allowed to go and inject people's faces just like that? And yes, we have to remember there are people doing this that aren't even medically trained, which is super alarming. But then there are also medically trained professionals doing this with minimal knowledge about how these products are best suited for their patients. So I definitely think going on a short course, it will set you up for failure and you will feel very underprepared and not confident enough to start your own full-blown facial aesthetics business. So when you're choosing a course, make sure you ask the right questions. How long is the course? What does the course cover? Do you get to treat your own model? Is there any support offered pre or post course? Okay, so you've booked onto the course, so you can just turn up, right? No, don't do that. To maximize your training, it's super beneficial to study the material before you attend the course. While some courses do provide pre-reading material, this alone is sometimes not sufficient. If you're completely new to facial aesthetics, do you even know how these substances work? Do you know what toxin actually does to your muscles? Do you know how your muscles actually work against each other? Do you know the anatomy of the face, or where the fat pads are located, or where the blood vessels are located? It's not easy to get your head around all of this, and I'm literally talking from experience. When I went on my first foundation course and they were talking about the lateral sousp and the deep medial fat pads and the frontalis, and how if you inject it, the brows will drop, but if you inject something else, the brows will lift, and something about a spot brow. All of this, obviously now it's like, oh yeah, I know what that means. But when you turn up and you're like, but wait, I studied anatomy at university in first year and second year. Why don't I get what you're saying? Just prepare beforehand so you actually know what's going on when you turn up to the course. And don't cram all your learning into the day before you attend the course, and consider spacing out your training. For example, you complete a course on toxin. You have a few patients lined up and you practice on them. You see how the results work. You're learning here. So then you move on to the next course, which could be a filler course. This staggered approach will allow you to consolidate your learning and build more of a solid foundation. And of course, after you attend the initial courses, return for some mentoring or some advanced or refresher training that will keep your skills up to date. It's not a one and done thing like everything in life. Number 3 is think about your training pathways. As of July 2024, the Royal Society of Medicine has officially recognised aesthetic medicine as a medical speciality. So it's not just a beauty thing that you're doing on the side because you got fed up with teeth. Oh, okay. Let's break down the different levels of training and what they mean for your practice. Firstly, the starting point is a foundation course. It lays the foundation. These courses often offer a basic introduction to aesthetics, such as toxin and dermal filler. I personally found that after doing a foundation course, I had a very basic understanding. It wasn't sufficient for me, and I couldn't confidently perform procedures. And I have come across or met up with loads of people that were on the same course as me, and they're either not practicing facial aesthetics at all, or they did it a little bit, they never got around to building it up. And I think that's because it just doesn't set you up with confidence when you attend just a foundation course. You just need to go in knowing that you're going to need to do some more training. So for those of you seriously considering aesthetics as a career, I would still learn the basics. I would still take time to consolidate all of this, but I would definitely come back for more advanced training. After you do a foundation course and you've seen a few patients, then you might feel like, yeah, I kind of like this. I want to get to know more. That's when you go on a few more advanced courses. So that could be in toxin, it could be in filler, like lip filler specifically, or cheek filler specifically, or full face rejuvenation. And these specialized courses, they delve deeper into specific areas and specific techniques. And while they do enhance your skills in particular treatments, I feel like buying these separate individual advanced courses does just add up in price. If you're serious about going into facial aesthetics, you want a broader perspective, you want to create more holistic treatment plans that address a full range of your patient's needs, then I would definitely go into the advanced training, which would be something like a level 7 diploma. I have completed a level 7 diploma and it was quite a transformative experience for me. I feel like I've learned so much, and I literally had no clue before, guys. Like when I went on my first foundation course, I didn't even know what Botox was. I didn't know what toxin was. I knew lip filler. I didn't know that you can inject filler into so many different places in the face, and I didn't know it was such a common thing that people had done. I just went into it blindly, like, okay, I'll try this. The more I did it, the more I found that I need to know more. I need to provide my patients with holistic treatment. I need to understand their needs, and I need to deliver the best treatments I can deliver. So the level 7 qualification is almost equivalent to a master's, and it provides a really in-depth understanding of facial anatomy, of skin science, of patient psychology. And these things you're not going to learn on a foundation course. You're not even going to learn it if you are just really good at facial aesthetics and you decide not to go on any more courses, it opens up your mind to other things that you just never considered. After doing the diploma, I've been able to diversify the treatments that I offer. I've been able to branch into skin treatments like PRP, chemical peels, microneedling, and stuff like that I didn't even know existed a few years ago. And I know I'm treating my patients as a person and not just a set of lips or a forehead that has lines in it. So I think it's really important, if you're serious about facial aesthetics and you care about your patients and you don't want to just take their money, I would look into doing a diploma of some sort. It really opens your eyes to the complexity of facial aesthetics and it allows you to value yourself more as an aesthetic practitioner. And finally is deciding your path. So you've done all of these courses, you know what all of these treatments are, you're actually really good at them as well. Remember, you need to also decide whether you want to be an independent practitioner, whether you want to work for an established company, or whether you want to own your own business with your own employees. So what are the benefits of becoming an independent practitioner? Autonomy and flexibility. You set your own schedule, you choose your own treatments, you build personal relationships with the patients that you see. They usually have your phone number. But while you have control over your practice, you're also responsible for all of the aspects of running the business, including marketing, administration, accounting. You have to ensure that you're prepared for all these hidden responsibilities. From my experience, being an independent practitioner is quite hard work, and I really did struggle to build a patient base, but I know that other people have really flourished. The second option is working for a clinic that's already established. Joining an established company provides structure, it provides an environment where the business is already managed for you. This is really advantageous if you only want to focus on delivering treatments and gaining experience. And companies sometimes offer additional training and mentorship, which can really help build the gap between your basic and advanced skills. However, you might have less flexibility in your schedule and you may have to compromise on which treatments you want to provide for your patients and follow what the company does. From my experience in working for a company, I love that I didn't have to do any of the other tasks. I just turn up and inject. It's a dream. However, I did find working for a company was very conveyor belt, 10-minute, 20-minute appointments, very focused on conversions and targets and how much money you're making, and not that focused on the patient journey and patient care. So that leads me on to my favorite and also my least favorite one, which is owning your own business. Owning your own business is amazing because it feels like your child and you have full control of everything, but it's also the hardest option. You have to consider setting up the clinic, creating a brand and an identity, hiring staff, managing them, ensuring they're getting patients, customers, and paying them on time. This path requires both clinical expertise and very strong business skills. You won't only be investing in your training, you will be investing in a business, and sometimes there are very high costs associated in starting a business. I have recently opened up my own clinic. There was a lot of initial financial investment and even more time investment, and the growth is slow, I will be honest. But I love being able to choose the treatments I want to provide and choosing the best brands and applying the best techniques for my patients. It's just quite nice. So that's all for this video. I would have really appreciated it if somebody on YouTube would have just broken this all down for me when I was first deciding whether I wanted to dabble into facial aesthetic. And now 3 years later, here I am giving you guys all the information I possibly have in my brain about facial aesthetics, about dentistry, and any general advice you guys need, just let me know, comment below. Anyone practicing facial aesthetics, please leave a comment below if you have any more tips and advice. Also, watch this video about all the mistakes I made when I was opening an aesthetics business, and I will see you guys in the next video.